Solutions team. Today we have Patrick. We are going to talk to you. We are going to walk you through a success story and how they have transformed patient experience by leveraging Salesforce products. We are going to go through that particular use case. Before we discuss that, the forward-looking slide, please make sure that any decision which you are taking are based on the current place and not what we have. We are showing in our solution experience. So please help me and bring Patrick to the stage. Welcome back.
Thank you, Yash. My name is Patrick Kokoruda, and I'm an Associate Vice President for a Patient Contact Center. And I'm going to talk to you today about our journey with Salesforce. First off, before I begin, who here works in a healthcare call center setting? Thank you. And thank you for the work that you do on behalf of patient experience and patient care. Working in healthcare is one of the most challenging jobs there is, but it's also one of the most rewarding jobs. Now, of us in healthcare call centers, we get phoned a lot for softwares that can do everything. Is that correct? Anybody? Yeah? So I must admit, when I was first contacted by Salesforce, I was skeptical, rightfully so, because I have a lot of software companies calling us saying they can do everything. I'm here to tell you about our transformation that actually did transform the patient experience and our operations in the contact center. As far as the challenges we had a very inconsistent customer experience. Complaints arising from misses, appointments not scheduled correctly, lack of self-service. We partnered with Salesforce and Persistent, and we wanted to lead in the patient experience. So our philosophy was really patient experience first. And there's a quote from Steve Jobs where he says, you've got to start with the customer experience and work your way back towards the technology. That's really what we did. We wanted to improve things for our patients today, not tomorrow, but today. So we started with our physician relationship, and this is community providers that are sending referrals to our hospital. This is so important. It's important because this is the patient's first interaction with our health system. That needs to go well. Second is our contact center. Handling millions of contacts a year, it's important that that's done well, because if you can't take care of me on the phone, how can you take care of me when I have a health concern? And lastly, nurse triage. Providing care advice to patients when they need it the most, preventing utilization that's unnecessary in your EDs and urgent cares. So we wanted to focus on relationship building, robust and timely patient acquisition, and operational excellence. Challenges prior to Salesforce implementation. I could go on, but I'm going to try to keep it brief. Patients weren't satisfied. We had complaints from referring providers about the difficulty to get into the system. We had doctors saying we have appointments available, but they still couldn't get an appointment. We had a very poor referral conversion rate, so patients were referred to the hospital but not actually having appointments scheduled. We had a large degree of difficulty managing the multiple scheduling requirements. Each clinic has their own scheduling requirements. It's very difficult to follow that in your electronic medical record. We had manual processes, duplication of work, a very high amount of patient amnesia, and that's really related to us not having a CRM system to tell us what happened with this patient. Did they call earlier today about an issue? And now they're calling back, I know nothing about that problem. We had multiple teams. If you wanted to schedule a radiology point procedure, you called one number, and if you wanted to schedule the follow-up that went with that, you had to call a different number. That all is a result of having to use multiple systems, multiple interactions with patients, and a disjointed patient experience. So I'm going to talk to you today about 3 use cases of the 150 use cases we did in a period of 12 months. The first is our provider relationship management 360 solution. The next is our patient acquisition solution. And lastly is our pediatric behavioral evaluations system. These are all problems that are happening in health systems across the country, from billion-dollar organizations to small pediatric specialties. So provider relationship management. Does anyone here handle referrals? Great. Do any of those come in on fax still today? We've got some yeses. Yes. We had that same problem. Referring providers, filling out forms on paper, faxing it over to a document imaging system, and us having agents in a call center rekey all that same information into the EMR. We wanted to improve that process. So we went digital with our referral management process. We created a dynamic referral form. So when you're referring to a patient to endocrinology and the patient has elevated labs for an HbA1c above 6, we say stop. This patient needs to call our urgent line immediately. Or we say, please make sure to upload any additional attachments such as growth charts and lab values. We're guiding the pediatric offices through the referral process. The next thing we wanted to do was make it simple. It took about 7 minutes for a pediatric office to fill out a referral on paper and fax it over to us. We got that down to 1 minute by having them do that online. The next thing we wanted to do was prevent them from having to call our contact center to check the status of a referral. So we gave them access to a 360-degree view of the referral. They could also message us with questions through Salesforce or upload attachments. We eliminated those manual processes and workflows, and it related to the outcomes of improved access and care coordination. We decreased our clicks 68% compared to our prior system, so we're processing referrals more timely. We improved our processing time from weeks to less than 24 hours, and we eliminated those calls from offices saying, hey, did you get this referral? So all in all, it was an improved experience for our referring providers. Next was our patient acquisition solution. This goes hand in hand with the referral process. Does anyone place manual outbound phone calls today to schedule appointments? Oh, yeah, you'll love this. So we were doing that, and then we started to use a dialer to contact patient because there's thousands and thousands of patients that are being referred to your contact center, and you just can't staff up your contact center enough, and half the time when you place an outbound call, it goes to voicemail. So we started using a dialer before Salesforce, but it required about 70 clicks to get one call to go out. Still not efficient enough. So what we did is we took a set of business rules and implemented it to Salesforce. And those business rules are as follows. If we received a referral today, we would send the patient a text with a click to call option to schedule the appointment. We integrated that with our EMR. So if the appointment was scheduled, we would stop contacting the patient. If it wasn't, 3 days later, we'd send them a phone call. But no one had to do anything in the record, it automatically happened. 3 days later, if it wasn't scheduled, we'd send them a message, an email, or something through their portal. 3 days after that, we'd send them another call or a letter. This is a very dynamic process that ensures that you convert referrals to scheduled appointments. If you can increase those visits to your organization, you can make sure that patients receive the care that they need, but also improve your fill rates. This process reduced clicks 80% for our staff, which was huge. But that's not the best part. Do you have lists that you work for your hospital? Return patients, follow-up patients, specialty to specialty patients? Well, we integrated that list from our electronic medical record to Salesforce. So when we wanted to call 1,000 patients, I can do that with 3 clicks. So I can set off the set of business rules for 1,000 patients in 3 clicks. That previously would have been 70 clicks for each patient up to 1,000 patients. So the efficiency has been huge, which eliminated overtime in our area, increased appointments, and improved our outreach. Our next use case is the Pediatric Behavioral Evaluation System. This was a very challenging area as well. As we started to have success with Salesforce, we shared that success across our hospital. We shared the results. People became interested. What is Salesforce? I never heard of this. And we'd go into what it was, and we'd start learning about some of the problems they had and how we could scale this across the organization. So the Pediatric Behavioral Evaluation System was patients who were calling our developmental and behavioral department because they needed to seek services there. But the process was they had to leave a voicemail, and then they were called back by a social worker who would mail them a packet of information to fill out and mail back to our organization for review. That process took about 8 to 12 weeks to get processed. Way too long, right? We routed those calls to the contact center where they get an agent now live who screens them out for suicidal or homicidal issues and sends them an electronic link to fill out that's that form. They can upload attachments, and that information can go to a social worker the same day they submit it. So we went from 8 to 12 weeks of getting information in front of a social worker to 1 day. Now that result has been transformational, but that's not the end of it. In order to actually schedule someone in our developmental behavioral group, there's a care team that reviews it. It's made up of providers, social workers, and nurses. We created a secure electronic handoff method for each of these areas to weigh in on this patient being seen in our organization. So it went to the social worker, they reviewed it and approved it, and assigned it to a psychologist who reviewed it and approved it, all through Salesforce. Then they click, the psychologist approves it, it comes back to scheduling to go through our patient acquisition solution so we can schedule the appointment. That's important because patients aren't falling through the cracks anymore. We have a secure, reportable way to identify where patients are in the process. These are just 3 examples of the 150 use cases that we worked on with Salesforce and Persistent that have helped transform our contact center. With that, I'm going to turn it back over to Yash.
Thank you so much, Patrick. Thank you so much. So Patrick shared his vision as well as he shared how they have executed all of these using Salesforce products. At Persistent Systems, we have been learning from our customer success. What we have done, we have built healthcare-based solution accelerators, and today we are going to see a demonstration of all of these. So Patrick talked about 3 specific use cases: physician referral. So I'm going to show you a physician referral portal, a call center, and a nurse triage. So let's quickly jump into the demonstrations. Let's quickly talk about a physician referral portal based on Salesforce community. Now, when an external physician is sending a referral out to you, the most important part for that external physician is how quickly someone can attain to my patient. Is it going to be a couple of days? Is it going to be 3 weeks out there? Because based on that, they are actually sending their referrals out to some other practices or hospitals. So the most important thing in that particular aspect is first availability based on a physician's name or based on a specialty. So this is what we are going to show you today. I'm directly jumping into the first availability slot. As you get to see, this is a physician portal developed on Salesforce community, and we can tailor the physician search and what it results into a name of physicians, what kind of insurance they accept, how close they are, and what is the first availability slot for that particular physician. Based on that, then a physician can make a decision to actually refer a patient. Patrick talked about automated process to send a referral in. So this is an example of that automated referral process. A physician or physician's office assistant can help, can upload demographics on basic information, upload clinical information, documents related to that particular patient, and submit the referral. They can also see what has been happening with my referral. So now, another piece which Patrick mentioned is 360-degree view of what is happening with that referral. So here is an example of what an external physician would see. As you can see, there is a referral date, what kind of documents have been uploaded, if at all the patient was admitted, you get to see some admission date, you see some details. Now the patient is being treated at the hospital. As an external physician, if at all I would like to know what is happening, I also get to see medical records, discharge summary if that particular patient has been discharged. If at all there has been a care plan created for that particular individual, an external physician can see all of this. So now this is an example of how the first availability lets the physician know how soon my patient will be seen, as well as a complete 360-degree view of what is happening with that particular referral. This is based on Salesforce community. Now let's quickly take the second use case in mind, which is a call center piece. Now a call center, I'm going to simulate bi-directional integration with the EMR. So let me quickly show you the EMR. Now this is an open EMR which we are using. We have Salesforce, open EMR, and in between we have MuleSoft as an integration layer. What it does is it takes information from Salesforce, pushes the scheduling in EMR, and brings the scheduling back into Salesforce. So that's what we are going to see. This is a calendar of a physician which we are going to access in Salesforce. So with that, let me now move into a persona of a call center agent. So let me refresh this one. I am a call center agent. What I am doing today is I'm taking a look at the appointments I am working on. So I see appointment details, some tasks I'm responsible for. So some pending tasks here, the appointments, who is going to show up, and down here some basic information about the patients I'm responsible for. Now let me simulate an incoming call. As a call center agent, while I'm working on it, I am receiving a call. As you know, the system based on the CTI integration pops up two specific screens here. I'm accepting the call. This is an incoming call. So I haven't completed the call, so I'm gonna minimize this and save this later for the call disposition. I see two screens here. My patient screen. Now this is an information view where I get to see some basic information. On the left hand side, what you see is out of health cloud. On the right hand side, you see lightning component, what we have built on top of health cloud, where I see last interaction with this individual or the individual's family, the appointments, the nurse triage queues, the call logs, incoming calls and outgoing calls, all of these things I get to see. So this is an information view in a case if you would like to understand the completeness of this particular individual. On the right hand side, I see a task-based view, what I'm supposed to do today. So as a call center agent, I receive the call, I verify the patient, and while I'm talking to the patient, I am also running the benefit verification. This ensures that what kind of benefits are covered based on the insurance information we have for this particular individual. Now I'm talking to Cindy's mother. Cindy's mother says that I would like to schedule an appointment with a cardiologist. So now this is a bidirectional integration, scheduling information inside EMR based on Lightning Scheduler. This is Salesforce Lightning Scheduler. I select a specialty. Let's say this is a cardiology. You can set up specialty as well as subspecialty here. What kind of appointment we are scheduling? We are scheduling an office visit. So let me run that. Where would you like to meet? So this you can auto-populate based on patient's data, patient's address, or whatever location they would like to have. So I select this particular place. Now here at the back end, it is bringing in all the physicians related to that subspecialty and their first availability. So let me select Dr. Porter. Now do you see what is happening at this end? It is fetching all available slots from the back end. Now this is the slate of available slots from the OpenEMR. There is a bi-directional API integration using MuleSoft, which is bringing in all of this data, all of this scheduling data. Let me go back here and show all of these availability slots from backend and pushing that into Salesforce.